When your family's in need of medical care, where should you turn? Come to Englewood Hospital, home of the most advanced technologies and medical equipment. Home to Magnet Award-winning nurses who deliver compassionate professional care. And home to more top-rated doctors than any other hospital in North Jersey. For your family's health, come to Englewood Hospital. We're closer than you think.
Good evening. Welcome to Dr. Gore's show. We, by popular demand, have Dr. Moorjani back on the show. And today we are going to talk about common viral infections and a little bit update and information on Ebola outbreak. Welcome to Dr. Gore's show, Dr. Moorjani.
Thank you for having me. Pleasure to be here.
Dr. Moorjani did his training at Maulana Azad. Then he came to New Jersey. He did his training at University of Dentistry and Medicine at New Jersey. And then he went on to do his fellowship in infectious disease at Stony Brook. So as the weather changes, there's some chill in the evening, and we know that kids are going to have runny nose and cold and fevers. So let's get some idea about what are the common viral infections, what's flu, vaccinations, what we need to do. To enlighten us, Dr. Moorjani is going to give us up-to-date information. So what is the reason why there is increased number of infection in fall compared to any other season?
So the dynamics between viruses in the environment and the human beings starts to favor the viruses during the cold season. The viruses are able to survive much better in the environment. And not only that, when you have a cold in the cold season, you're more liable to spread it since the air is not as humid, and the viruses can remain suspended in the air. And so the efficiency of transmission from person to person increases. And that's the reason you see a higher number of viral infections starting in the fall and into the winter. That doesn't mean there's no viral infections or colds in the summer. There are, but the numbers are much less. Not only that, it also has to do with the spread from human to human, as I said. So in the cold season, people are less liable to be outdoors.
Correct, you're confined to a closed area.
Into the indoors closed area, and there the transmission becomes much more efficient for the viruses. So you start to see more people getting infected and more people becoming symptomatic.
Correct. And you indoors, your windows are closed, everything is closed. In summer, like you're outdoors, and there's less transmission. Now, what are the common viruses which can give infection during fall to winter season?
So the commonest is, of course, the flu. Okay. But before you see a flu epidemic, and we have now sophisticated epidemiological tools that we use to monitor the flu outbreak and the infections around in the United States and, for that matter, worldwide. But before you get into the real flu season, there is the common cold, the rhinoviruses, coronaviruses, enteroviruses, adenoviruses, parafluviruses, many different respiratory viruses that can cause a flu-like illness, but it's really not the flu. There's one thing that differentiates flu from all the other viruses, and that is the absence of sore throat and systemic symptoms, body ache,
malaise,
high fever, malaise. With a cold, generally it's runny nose and a little bit of maybe sore throat, congestion, coughing a little bit, maybe a little bit of bronchitis, but really the bone-chilling fever and the aches and pains and the rigors that you get with flu is the hallmark of that disease. And it's easy to differentiate flu from all the other viruses.
Right. So usually people will come with common cold, they'll feel a little bit, they're coughing. Sometimes the general practitioners, give them antibiotics. What do you think about that?
So you go to see a doctor, you have a cold, you have the flu, you have a virus infection. Antibiotics are not going to work for the most part in a situation like this. And the reason is very simple. Viruses don't respond to antibiotics. Majority of the upper respiratory infections and otherwise healthy people, including children, are viruses. It is estimated in many studies to be anywhere near 90 to 95% of upper respiratory uncomplicated presentations in healthy people are viruses.
Correct.
Do not require antibiotics.
Exactly.
However, you're in a doctor's office, you're feeling sick, and you tell the doctor that you're feeling so bad, you have fever. if the doctor tells you to go home with chicken noodle soup and warm saline gargles and whatever other home remedy, and you don't get an antibiotic, but 5% of the time you get a super infection 5 days later, 1 week later, you're going to say, well, the doctor didn't treat me properly.
Or they missed it.
Or they missed the diagnosis. So it's easy for pediatricians and internal medicine doctors and family physicians to overprescribe antibiotics. This has been well documented in this country for many decades, and it has led to a huge problem on the other end, which is the emergence of bacterial resistance. And when you really have a bacterial infection, those bacteria are now resistant to the common antibiotics, leading to the use of expensive, more potent, but however, antibiotics with many other side effects and problems. And these bacteria then not only are they resistant, they're also more invasive sometimes, leading to more serious infections. So we have a huge problem with antibiotic resistance right now. And one of the major initiatives of the CDC is to reduce routine use of antibiotics in uncomplicated upper respiratory infections.
Correct. And I think it requires education not only on the patient side, but also on the physicians who are on the forefront. If that too, it's very important for topics like this to be discussed on a routine forum, because anytime there's a runny nose and if you don't have high-grade fever, there's no chills, there's no productive cough, just stay home, take Tylenol, drink, and you should be okay. If it doesn't get better, I think the common knowledge used to be 7 days. Either you'll get better with medication or you'll be better without medication in a week. It's the same thing. I think that's really important that everybody knows that. And if it doesn't get better, I think then definitely they should seek medical advice. But as you suggested, I think, warm soup, chicken broth, hot water gargle, haldi, I think is a great tool to help.
There's a lot of evidence in Ayurvedic medicine about the use of turmeric and its antibacterial properties. And I'm one of those that some of my friends and family members know about this, is prophylactic, dissolving a little bit of turmeric in warm milk every morning to coat your upper respiratory mucosa and the pharyngeal mucosa to prevent bacterial infections. It's something, turmeric is being studied by the NIH in many different ways for its many different properties. I highly recommend it. What's the harm?
Right, and it's actually purifying because it has so much anti-inflammatory,
antioxidant properties. Yes.
I think it's good to take it on a regular basis as well.
Yes.
Also ginger, I think it's a great, people have ginger teas and that kind of helps with the sore throat. So I think those are home remedies which especially during pregnancy, when patient comes with this common cold, I try to tell them, do this, and they look at me like, you don't want to give antibiotics? I'm like, no, try this, it's going to work. Most of the time it's going to work. But of course there's a role of, when there's a sore throat, to do a swab and look for group B strep and treat it accordingly. So that also needs to be, educated to the patient. Sometimes it doesn't go away just with common remedies, then they definitely should seek. So what's your advice on strep throat? What do you think, what are the symptoms, how do you find it, and what antibiotics should be given? Because sometimes there's a confusion, especially with the kids.
Yes. So most of strep throat is caused by group A strep. There are many different varieties of streptococci. Group A is the commonest cause of sore throat, by far the overwhelming cause of strep throat. In children, it's a problem because it can lead to other non-infectious complications of the heart, of the kidney, and it can cause major skin problems, joint problems. Rheumatic fever is a well-known entity. So antibiotics must be given in someone who has a confirmed strep throat. And it's not urgent to do the antibiotic right away. You can do a throat swab. If the strep screen is positive, you give prescribed antibiotics. But that doesn't mean the patient has group A strep. It could be rarely other groups B, C, D, E. Having said that, if the patient is strep swab negative and you see a classic presentation of strep throat, the exudative tonsillitis, pharyngitis, and fever and tender cervical lymph nodes, which is painful lymph nodes in your neck, then you should, if the throat swab is negative for rapid group A strep, send it for a culture, observe the patient, and if the next day the culture comes back positive for group A strep, start the antibiotics then. Once you give antibiotics, the cure rate is close to 99%.
Wow.
In some cases, it'll fail for many reasons. There are several reasons for that. And you can always give a stronger, different type of antibiotic that will eradicate the strep throat. The more interesting part is, should adults be treated for strep throat? By itself in adults, group A strep does not lead to the complications of streptococcus, post-streptococcal complications. So what is the rationale to treat an adult with antibiotics? The adult is going to get better anyway, unless they're immunosuppressed, different story. So in the non-immunosuppressed healthy adults, there's no reason to treat group A strep, except the fact that they could transmit that group A strep
to the kids
and other people who may be immunosuppressed. So in that situation, you're treating the group A strep in an adult, not so that the adult can get better faster, but because you don't want that spread into the community to other people.
Right.
And so, again, easy to treat. Penicillin works.
Correct.
In people who are pen allergic, there are many other choices
to be treated. So yes, at certain situation, antibiotic is needed and it should be taken, but always seek medical advice at that time. So coming to flu virus, influenza virus, you look into history, how many people have died because of flu epidemics and endemics. And I think recently everybody had the scare a few years back with H1N1, the swine flu. So tell us about flu. It's a very common infection during winter. And there's so much confusion sometimes about what should be done, what should not be done. So vaccination, prevention. So let's talk about flu.
So flu virus is, again, a group of viruses classified according to their structure of their enzymes. And for the common person, for most of us, it's flu A and flu B. There are two major types. And in flu A, you can get many different types of varieties of flu A virus. The virus's natural host are the birds and the pig. Ducks, for example, pigs, any avian bird can harbor the flu virus. Humans acquire certain types of flu viruses which have the structure which can bind to the receptor in our respiratory mucosa. So if they have that specific antigen which can bind to that receptor, then they cause influenza or flu illness in a human being. It starts with a sore throat because that's where the virus first attacks. The virus then gets internalized into the mucosa and through the mucosa into the lymphatic stream, and then spreads into the respiratory tree by multiplying there on the surface and in the lymphatic. So the first manifestation is a sore throat. And then you get a little bit of cough, irritation, and then you start to have these chills because the virus then spreads through the lymphatic stream and into the bloodstream.
Systemic.
And you get these body aches and pains which can be actually very disabling. Some people describe that they can't even get out of bed. And you feel extremely fatigued, you have these chills, you have fever, you have sweats, and then the sore throat. And it's, again, very easily recognized because it doesn't cause exudative pharyngitis. It's inflammatory. So you have some inflammation, you see the redness, the lymph nodes are swollen but not tender, they're not painful. They may be very little painful but not majorly like group A strep. And you can get respiratory infections, sinusitis, and the entire respiratory tree could be involved. The thing with the flu viruses that differentiates it from all the other viruses is the ability of the virus to knock out your immune system, commonly for about 1 week to 2 weeks, but in some cases up to 6 weeks. That predisposes that patient who has the flu to a secondary bacterial infection within a week, 2 weeks, up to 6 weeks. And that's the dangerous part. So people who have a compromised respiratory system, people whose heart is compromised because they have previous heart attacks or congestive heart failure, cannot deal with the stress of that flu virus in the patient's body. That can then lead to heart failure, can lead to secondary pneumonias, bacteria take over, they start to multiply, and that can actually lead to a lot of problems, including mortality. It's estimated about 40 to 60,000 people every year die as a result of direct flu infection or super infections related to the flu virus in this country. And that is why it is such a big deal.
And also, as you just mentioned, people with chronic diseases, so be asthma, diabetes, cardiac issue, kidney issues. Pregnancy is an immunocompromised state, so they are more at risk, children. So those are the people that they are at risk population, and those are the ones which, there are recommendations specific for this population compared to
Correct. So anytime you have an immunosuppressive state where the immune system is not working, diabetes is one of the common ones that we don't even think of sometimes as an immunosuppressive state, but it is.
Correct.
People with kidney failure on dialysis, anybody with an underlying lung problem from smoking, COPD, or previous lung disease from whatever. Once your system is compromised, this virus can wreak havoc. And it is, what is important about this virus is, one, if it's recognized early, it can be managed, and almost all complications can be prevented. Or two, more even better, is it can be prevented to begin with. There's only one always in medicine, and that is prevention is always better than cure.
All right, so I think we're going to continue our discussion on flu after this short break. See you soon.
When your family's in need of medical care, where should you turn? Come to Englewood Hospital, home of the most advanced technologies and medical equipment. Home to Magnet Award-winning nurses who deliver compassionate professional care. And home to more top-rated doctors than any other hospital in North Jersey. For your family's health, come to Englewood Hospital. We're closer than you think.
Welcome back to Dr. Ghosh Show. Today we are talking about common viral infections, especially flu, and a little bit touch upon Ebola. So going back to flu discussion that we are having, yes, it's a very drastic symptoms sometimes with the flu. But what's the incubation period for once, suppose you expose somebody at work, somebody at, in the house, or just the virus is there on the knobs, on the telephones, it's everywhere, especially in the flu season. So what's the incubation period?
Once a person acquires the flu virus and it attaches to your respiratory mucosa, it can take anywhere from 3 to 10 days for the virus to present with symptoms.
Okay.
That's what we call the incubation period.
Right.
Once the symptoms occurs and the patient is symptomatic, now you continue to shed the virus during the asymptomatic incubation phase.
Okay.
And for up to 3 to 4 days afterwards. In some people it can go on for 3 weeks, but those are the super spreaders, the super shedders, the immunosuppressed who have high-level pneumonia. So in people who are admitted with flu pneumonia, we will isolate them in the hospital for up to the duration of time till they are completely back to recover, until they have completely recovered from their symptoms. But in general, for people on the outpatient side in the community, it's anywhere from 3 to 5 days after symptoms that you can continue to...
Right. And I think most transmission happens when you are asymptomatic because you have no idea, and that's how it spread. When you're coughing and obviously fever, people keep away from you. But also the transmission is very easy, correct? It's through the airborne.
It's airborne transmission, and that's why masks will help prevent it. I've seen recently, not recently, but last year in a winter time, when there was this big flu epidemic going around, people coming to social occasions with masks. I thought that was a little bit more on the overcautious side, but people do this kind of stuff.
I think I have seen a lot of pictures when the swine flu was happening, H1N1, people on the wedding pictures with everybody with the mask. I think in a way, yes, it was good that people were very, conscientious of transmission and getting it. But yeah, it made a lot of highlights with those pictures. So tell us now, once you have it, is there any treatment? And especially with immunocompromise, the medications, the Tamiflu. So shed some thoughts about that.
So flu is treatable. There are 2 drugs we have today that will treat the flu virus, especially in the immunocompromised people who are at risk for complications, people who have flu pneumonia, who are hospitalized with severe infections. So you can give treatment. There are some other expanded access drugs that you can get from the CDC in those who have documented resistance. So, the virus, just like any other bacteria or virus,
changes.
Once you expose them to a medication, the virus can acquire resistance. And this is no exception to that. So we do see resistant flu in the hospitals and in the community occasionally. And we manage it by supportive care and allowing the immune system to, for the most part, to take over. Or if you want, you can call the CDC and try to get this new medication which is available for severe infections, drop shipped and treat the patient. So you can treat, but more importantly, you must prevent the super secondary infection, bacterial infections that occur. And you do that again by just essentially supportive care, allowing the immune system to recover faster, and making sure that the patient, if they're a smoker, they should definitely not smoke. In fact, they shouldn't have been smoking in the first place, but no alcohol, good healthy living, good healthy lifestyle.
And
staying
control
at
the
home.
underlying disease. If your sugars are high, control the sugars, make sure...
Optimize the body so the body
Correct.
can now do
Fix
its
it
job
and heal it.
and heal itself and protect you from
Super
other
infections.
super infections. Yes.
So there are medications available for special need, and that's always good to know because sometimes people don't know that. So yes, there are medications available for specific populations. The most important thing is prevention. So how do we prevent, flu, especially the vaccinations, and there are some new vaccination coming. So shed some highlight.
So clearly a preventable disease. The efficacy of the vaccine in all comers, if you take the entire population, is about 65 to 70%. But those are studies done with the old formulations of the vaccine. With the new formulation, if anything, it's probably higher than that.
Okay.
So assume that in the people who are 60 plus or 65 plus with compromised body functions and immune systems and compromised lung function, compromised heart function, there the efficacy is probably in the 50 to 60% range.
Okay.
But young healthy people, the efficacy is probably in the 80, 90% range. And now this year, we have new formulations of the vaccine, which are even more efficacious. There's an intradermal form, which is thought to have better protection. There is the high dose form, where the protection can last for more than 5 or 6 months, which you get routinely with the normal dose vaccine. There are live vaccines now available for people where it's not contraindicated, where you don't have any other medical issues.
Okay.
You can take the live vaccine. In people who have egg allergy, who have for many years shied away from using the vaccine because it's grown in a chick embryo, which has got the same albumin as the egg, and it can cause reactions. Now we have a recombinant vaccine for the first time this year, which can be safely given to patients.
Right.
With egg allergy. The vaccine this year is a little bit different than last year.
Okay.
It has 4 different types of flu viruses, 2 type A and 2 type B.
Okay.
Normally we have vaccines that have 3 types of viruses. This year there are 4. And I highly encourage everybody who is, I'm an adult infectious disease doctor. Anybody above the age of 18 should go get themselves vaccinated for flu. And probably the right time to vaccinate is
I was just going to
somewhere
ask you that.
in October. I think it's a little bit too early. I know the vaccine was released last week, and there are signs out there at all kinds of pharmacies saying, come and get your flu shot for $10 or $12. I think it's a little bit too early. We have a very highly sophisticated and extremely effective program of monitoring for flu activity. There are no reports of flu activity in this country today. I think if you take the routine vaccination now and the duration of efficacy is 6 months, your protection will
Be
wear
done by
out
March.
by February, and by March and April, when the second attack of flu occurs, the flu bugs, you will be susceptible. So I am encouraging all my patients to wait till the end of October to get their
end of
flu
October.
vaccinated. Yes, mid to end October is when I would
It's
recommend
ideal time to take it.
to take, and it is preventable. Even if it doesn't prevent the flu infection, it will reduce the severity
of the thing.
So you will be able to deal with it. Your body will already be primed. Your immune system will be able to control that virus. Symptoms have to do with the amount of virus that internalizes.
Correct.
So if you have a pre sort of immune system priming, which can limit the spread of the virus, the symptoms will be
And
much
the multiplication of the virus to
much less,
then the severity of the symptoms is much less. Talking about the different forms of vaccination, the intradermal and stuff, I still remember when they came up with the nasal for the children. I think that was a good welcome kind of a vaccination, because I think the kids were more happy then to take it rather than take the injection. So it's great to know the science is working and they're trying to kind of get to a better level every year, and we see such an advancement every year. Apart from the vaccinations, what do you suggest as prevention? How do we limit the transmission?
So one thing is, if you are sick with the flu, don't go to work. Because you go to work in a winter time with the flu in a closed environment, you're going to spread it to your coworkers. Don't go to school if you're sick. If you're a kid, the parents should keep the kid home from school and get the kid tested in a doctor's office for the flu. Again, the rapid test will tell
Correct.
you whether you have the flu or not. 40-50% of the time, maybe not all the time. And 2, if you are symptomatic and you are going to be in and around someone, then try to wear the mask. If you think you have the flu and you have the flu, then wear a mask to prevent the spreading. more importantly than any of this, stop smoking. If you are a smoker,
Correct.
stop smoking, because that compromises your ability. If you're drinking alcohol, stop drinking alcohol. Alcohol affects your immune system. Just good, healthy living, and hand washing is another very big thing, but the virus
Absolutely.
can be carried on hands. And we've always said, Igor Semmelweis, who many, many years ago said hand washing was probably the single most important intervention in spreading any infection.
Correct.
Holds true for flu too. So
Absolutely.
wash your hands with soap and water, and those are the things you can do.
Correct, to prevent the transmission. So very briefly, we're going to talk about Ebola. Ebola, you hear in the news, so, you've seen some pictures and, news from Africa. So what's an Ebola virus, and, how does it get transmitted, and, what can we do to prevent if we are traveling to those areas?
Yeah. So Ebola virus, it belongs to a family of viruses called filoviridae. They are hemorrhagic fevers. The virus can spread in human systems and cause havoc and create a lot of bleeding problems and death rates anywhere from 20% to 80%, depending on which epidemic and which type of Ebola virus you're talking about. Most of these viruses live in the Far East and in the jungles and in the jungles of Africa. What happens in Africa, for example, these various outbreaks, is humans go in to hunt for bushmeat. Some of the bushmeat animals, like the fruit bats in Africa this time, carry the Ebola virus. They're normal reservoirs. So the virus normally lives in these fruit bats or other animals which are used for bushmeat.
Monkeys and chimpanzees.
Yes, so the humans go in, there is a big, huge bushmeat trade going on. In Africa, they don't wear gloves. They handle these animals with bare hands. There are cuts on there because of the hunting practices. The virus gets into the human system and starts to cause havoc.
So it's usually through blood products and secretions.
Blood and body fluid secretions directly inoculated into the human system through a cut on the hand or anywhere on the body for that matter. That's how it starts. And then it spreads from human to human, not through airborne transmission, but by direct contact. And in Africa, being a resource-limited country, gloves, gowns, masks, not available. Family members handle the patient's body.
Secretions.
And body secretions with bare hands, and they have cuts on their body because of routine daily activities, and they get infected, and this is how it spreads. Now there's also a ritual in Africa where the person who has died of Ebola undergoes a funeral. At the funeral process, the relatives have to handle that body with bare hands, and that spreads the virus, because the virus can live even in a dead person for many days. And that's how the spread has occurred, and it's caused havoc this time. This Ebola virus outbreak has actually now crossed 2,000 people with more than 1,000 deaths, 50% mortality so far. But we don't know the exact spectrum of the disease. It could be some asymptomatic people and some who are very symptomatic, and maybe we are just picking up the ones that are very sick, and we're not hearing about the ones that are not very sick.
Like a carrier. And, get a flu vaccine. This is the season to get the flu vaccine, starting from October. So I think all these points, if you keep in mind, and don't forget the turmeric, the ginger, and just good fruits and vegetables and green leafy things, which is going to increase your immunity. I think the peppers and blueberries, I think we have to incorporate more of those in our diet. Hopefully this will help and will prevent infections this fall season. Goodbye till next time.
When your family's in need of medical care, where should you turn? Come to Englewood Hospital, home of the most advanced technologies and medical equipment. Home to Magnet Award-winning nurses who deliver compassionate professional care. And home to more top-rated doctors than any other hospital in North Jersey. For your family's health, come to Englewood Hospital. We're closer than you think.